receive hospice care. We've looked at the economics of care around the United States, and I apologize to you to this slide. I think it may not be easy for you to read, but it only points out that if you live in New York City, where you all know it's expensive to live, it's also expensive to die there. And it costs about twice as much to die in New York City as it might cost to die in Arizona or one of our southern states. So there's a disproportionate cost to care that we don't fully understand, but we think is about inappropriate use of high technology in the last days of life. In the US now, there are more than 4,700 hospices. Approximately 1.4 admissions came to US hospices, and within that number of patients who were cared for in hospice care in the year 2007, there were 930,000 deaths. Only 8% of hospice deaths are occurring in acute care facilities. So this is an extraordinary home-based care system providing care to patients and families in their homes with referral to freestanding hospices if needed, but for the most part, 80% of the care is being delivered to patients in their home setting. And most patients die in their home setting, 75%. So this evolution of the hospice movement, which began in the early 70s as a grassroots movement, has been quite extraordinary, and again, is an entitlement program supported by the government. 80% of hospice patients are over the age of 65, and the length of stay in these programs is about 48 days. 30% of hospice patients are served for only 7 days, and 13% for more than 180 days. And I only want to point out the fact that 30% of patients only are receiving hospice care for 7 days, and this reflects the difficulty of patients willing to enter hospice, because to enter hospice means that you cannot have access to any further chemotherapy or any new treatments for your illness. So we've made a very sharp distinction in the United States between care of the dying and continuous care. And this has led to the development of the whole construct of palliative care as a service that would be much broader than hospice care. And so through the efforts of a Center to Advance Palliative Care at Mount Sinai Hospital, there's been major work to develop a consensus project on palliative care. And this consensus project is really suggesting and identifying and setting standards for moving hospice care earlier into the care of patients with serious illness. And so this is the model that is proposed, and this is the model that we are working forward as we advance palliative care, in which you see that palliative care, again, is balanced with curative care, but that it provides support throughout the course of the illness, and the amount of palliative care provided is absolutely directly related to the care that a patient needs, depending upon the status of their medical illness. The good news for palliative care, which we'd like to think has happened now in the last 10 years, is rapid growth. 30% of all of our hospitals now have a palliative care team. 50% of hospitals over 75 beds have a program. 70% of hospitals over 250 beds have a program. 75% of the Council of Teaching Hospitals have programs. And 46% of hospitals with a population of 1 to 2 million have a program. So we have now embedded within our hospital systems palliative care consultation teams and units. The American Board of Medical Specialties has now recognized palliative care as a medical specialty. This was not the case 10 years ago. Our National Quality Forum that sets quality standards for care has released a report, a framework for palliative and hospice care quality measurement and reporting, giving us the opportunity to show how our standards are influencing care. And on a public side, Newsweek magazine features palliative care as one of the top 10 solutions to America's hospital crisis. They've been, and they've also identified, when they rate hospitals in the country, they rate them according to a variety of factors, including palliative care. The American Board of Hospice and Palliative Medicine, which began in 1996, has now been fully incorporated into the American Board of Medical Specialties. And at the present time, there are more than 2,000 current delegates who are boarded in